Today we shall review the case of a 3-year-old girl having a rhabdomyosarcoma of the right orbit, not responding to radiotherapy. The patient was planned for surgery and embolization was performed preoperatively. The mass was fungating with the ulcerated surface and the globe was completely destroyed and pushed outside the orbital cavity. Patient was taken up for pre-surgical embolization. The right common carotid injection showed multiple fine intratumoral vessels. Selective right internal carotid artery angiography showed significant ophthalmic artery supply to the tumor, which makes the procedure challenging. Selective right external carotid angiography showed extensive supply from multiple branches of internal maxillary, facial and superficial temporal arteries. Then a 2.7 French per grade microcatheter was navigated and infusion of PVA particles was performed superselectively to occlude the internal maxillary artery feeders. Then microcatheterization of the facial artery was done and infusion of PVA particles was performed to occlude the facial artery feeders. Right common carotid artery injection prior to direct puncture showed significant supply from the ophthalmic artery. Embolization through it is prone to complications. Direct puncture was done under fluoroscopy and parenchymogram DSA was performed. The aim is to access a vessel and map the area as well as any dangerous communications. Another needle was put in place and parenchymogram performed, showing the venous opacification. 20% glue was injected through these needles. Subsequently multiple punctures were done sequentially and glue injected to cover as much territory as possible safely. After multiple punctures and glue injection, the fluorospot image here shows the final glue cast in the tumor. Post-embolization right common carotid artery injection showed near total tumor devascularization with intact main ophthalmic artery. Left common carotid artery injection showed no supply to the tumor from this side. The procedure was closed at this point and patient extubated. The patient was operated next day by the ophthalmologist team. There was practically no bleed and the tumor could be removed in toto. Patient has been doing well since then.